Yes, if you are not ovulating on time, that is a matter of concern, whether it be early ovulation or it be late ovulation. So first and foremost, if your ovulation is not on time, then definitely the time period when you are staying with your partner, the time period of your implantation gets changed. Many patients, when we do embryo transfer, many patients we have done embryo transfer in the first half of the cycle also, and many patients the embryo transfer is also done in the later half. Many times at 35 days, 40 days, the patient gets disturbed, because it is the truth, the body is timed according to that. So same will happen when you are planning for your pregnancy naturally, whether you are ovulating which time, that is very important. And it is not necessary that if you have ovulated once in your cycle, at that time you will be ovulating at the same time in the next cycle. So studies document that it becomes difficult, especially if the ovulation is being very late. If early ovulation, many times the cycle is shorter, so obviously many times the egg quality is affected if the patient is not ovulating according to the time, according to the body rhythm. So the doctor definitely needs to check your eggs, and definitely needs to check that what are the other hormones that are affecting it. If there are no hormones that are affecting it, then obviously you have a good chance of conception. But if your hormones are deranged, then there are bleak chances that you will get pregnant naturally. Then you need to take support of assisted conception. We care about you.